Pretend that this is your own patient. What would be the most important things to consider if they are infected with a serious disease? We know of the severity that certain diseases pose to our healthcare system, and we also know that different areas of our planet allow humans to be susceptible to different types of viruses and bacterial species. HIV, malaria, Alzheimer's, and smallpox are all examples of these geographically shaped diseases. It would be normal for doctors to ignore evolutionary roots of their patients when diagnosing, but this needs to change. In this video, we will be exploring how can patients' geographic origins affect how we diagnose their diseases. Essentially, by understanding a patient's geographic origins, healthcare professionals are able to understand the risks of inheriting good or bad genes from certain geographic regions, and applying that knowledge of the healthcare risks that these genes create for the patient. There are many examples of population differences in disease susceptibilities. Caucasians are more likely to be negatively affected by a gene that can increase Alzheimer's risk. Because of this, if we know a patient has the gene and is of Caucasian origin, healthcare providers are able to better understand someone's actual risk of developing Alzheimer's. There are also examples of certain genes providing resistance to HIV. Europeans are far more likely to have a gene for resistance to HIV, and they may have it because it helped their ancestors combat smallpox or the plague. This is what is commonly referred to as the Viking hypothesis. People of African origin are more likely to have sickle cell anemia, a disease where some red blood cells are sickle-shaped and destroyed by the immune system, leading to a lack of red blood cells in the body. The reason for this disease being more prevalent in Africans is that a single copy of the gene for sickle cell anemia is beneficial to have because it makes someone resistant to malaria, which is extremely common in Africa. This causes a massive trade-off between both diseases and needs to be considered when diagnosing patients with African lineages. As well, patients' geographic origins can help healthcare providers decide what kinds of treatments to provide for patients. For example, not only are Asians less likely to have asthma than other populations, but their symptoms are less severe, so wouldn't require the same treatment as other countries would. So, why is this important? Well, for a healthcare professional, by understanding a patient's geographical origins, treatment specialists can diagnose the disease faster and provide the patient with a more accurate diagnosis. As well, this also provides the patient with a better understanding of their own individual health risks that come with their ancestral links. And finally, it also helps the healthcare professional provide the correct level of treatment so that antibiotic resistance and overtreatment can be limited.